Hi, today I'm going to inform you the major factors of kennel cough, what kennel cough is, the symptoms, and treatments. Knowing what kennel cough is and where your pet can get it picked up from will overall help both of you so that way you know what to prepare for and so that way your pet can be quickly treated. I've been working with dogs for almost 3 years now, and I'm working on getting my associates in basics of animal science. So I know a thing or two whenever it comes to illnesses in a pet. According to the American Kennel Club, in July of 2025, kennel cough is a highly contagious respiratory disease that your pet can pick up from virtually anywhere, whether it's the park, a dog boarding facility, or a doggy daycare. Even if it's a super clean place, your pet can still pick it up from a boarding facility because of unvaccinated pets. However, if your pet does have their Bordetella vaccination, then that'll help prevent your pet from getting it. I'm not going to say that it's going to be a complete prevention because sometimes things do happen, like whenever you get the flu, but you have your flu shot. It's not a complete preventative, but it still helps it already be in their system to where it won't hurt them as much. A few symptoms of kennel cough can be coughing, runny nose, sneezing a lot, being extra tired, not wanting to eat, and even having a low fever. Now, a good way to figure out if your dog does have kennel cough is to beat on their sides. And now, I have a lovely assistant here that'll help me show you what I mean by beat on their sides. So when seeing if your pet has kennel cough, what you want to do is you want to have them next to you and you just kind of want to beat on their sides real hard and kind of beat on their chest and beat on their other side. Now, if you do that, then they will normally start coughing or sounding like a honking noise is coming from their chest. And that honking noise means that they are coughing and that they aren't feeling too well. And it's most likely that they have kennel cough. What you'll want to do at that point is take them to the vet, because the vet will be able to give them prescribed medications such as anti-inflammatories and antibiotics, so that way you can administer them yourselves, but your pet will get feeling better much faster. Also, the vet might give you cough tabs, which kind of work as an anti-inflammatory. You just give them to your dog, and it helps soothe their throat and also makes them not cough as much, which overall is better for them because it's not going to irritate them as much. According to the Vet Charity for Pets in Need, in June of 2020, pets will often need a lot of extra TLC when they have kennel cough because they're not going to really want to do anything. They're not going to want to eat. So you'll have to pay extra attention to them and probably give them some extra love because they're just going to lay around and wallow and show that they're not feeling very good. So you might have to take a little bit extra care and just loving on them and letting them have their rest, but also letting them know that it's okay to eat and that you're backing them up. Also, a good thing to do whenever your pet has kennel cough is keep them away from others. While it may make your day a little more complicated if you can't drop your pet off at daycare and let them just get all their energy out throughout the day, it's overall better for them because even if your pet hasn't had any symptoms, it can still be given to another animal 2 to 3 weeks after their last symptom, which is an additional 2 to 3 weeks of nothing happening, not sounding sick, not needing any meds, but they still shouldn't be around others because they could pass it on. Now, a good way to prevent kennel cough is making sure that their vaccinations are up to date. Like I said, with the Bordetella vaccination, Bordetella technically comes from kennel cough because the long scientific name starts with Bordetella. So it's overall easier for people to remember just that simple, easy part. Now, kennel cough vaccinations, depending on the place, you'll have to check with your daycares or even with your vets. Because at a daycare that I used to work at, we would only let your Bordetella vaccinations be considered for 6 months if it was intranasal. AKA, you took your pet to the vet and they shot a liquid down their nose. Now, like I said, you'll have to consider the places that you're going and what their range is for vaccinations. And like I said, this vaccination isn't going to completely cover them like a flu shot. It'll put kind of a watered down version of the virus into them and make it become a preventative. But it won't completely 100% stop it. So if there is a large outbreak of kennel cough, it might be safe to just keep your pets at home with you. In conclusion, there are thousands of factors that come in when it comes to kennel cough. Because no matter how clean a facility may be or how clean you think a park is, or even if you think your pet is still vaccinated and up to date, you'll always have to keep an eye on certain things to make sure that your pet won't be as high risk to get kennel cough, because it does overall hurt them, and some pets can retain a long cough and even make that just a common thing that they have, even if they don't need medications for it. With knowing these factors, it helps you and your pets feel more comfortable in how you are going to handle the situations. Thank you.